Yes.
But Dr. Akintayo, I'm wondering, I mean, what you said about even if the person is discharged, they can still transmit
Yes.
2 months after.
Yes.
I thought it's different with what I think the CDC says, that once you recover, you may not be able to transmit.
This boils down to our local play here. The infectious disease hospital does not really have capacity to hold many people. Now, when I say that, is that if there are 50 people coming down with Ebola at the same time, can they really take it right now? That's why they are building camps. Now, CDC, before they discharge anybody, they will be very certain to have run all the tests, and it's a large center. So before this, you are sent home. They have done the last ELISA or PCR, polymerase chain reaction, to check the proteins in your body from Ebola, and it's not there, then you can be sent home.
So in that circumstance, if you're sent home,
yes, you are free of transmitting to anyone. But if you are discharged a week or 2 weeks after you've been deemed to have survived this Ebola, then I think people should be kept in until they are certified fit, because there's a lot of pressure, and it's not only in Nigeria, some hospitals around the world too do. There's a lot of pressure on hospital facilities. If people keep coming, they overwhelm your system. So what you do is you manage them to a certain level that you know that coming from outpatients they can be easily managed like that. Now, Ebola should not be done like that, but there's a risk of that going on if the epidemic rises more than this. Now, I just want to talk about the epidemic briefly. This is the second epidemic that has occurred, Ebola. Now, the first one was Congo, Sudan, and that they had about 1,700 cases. Now, but this is the fastest and possibly the most dangerous, because in a short while, up until mid-August, we've had 1,217 cases as documented by WHO. And if we are not careful, probably beat the previous record set. And this particular virus that's involved is most dangerous of them all. We have different types. We have the Zaire type, the Sudan type, the resting type. The one we have here is the Zaire type. If people are not properly cared for, the mortality can be as high as 90%. Can be as high. But right now, it is not that high. And that's because they are getting what they call supportive management. That's the only way you can treat these people. You cannot, there is no known cure. That's the fact. There's no known cure, and I'm not sure if there's anyone in sight. But there's some vaccines, and some medical personnel are still wary of the vaccines. But vaccines are actually viruses or sometimes serums that you take from people that have Ebola viruses, and then you change something in them. And they don't become so effective, but they can elicit some form of protective mechanism in your body. So in case the virus is not properly attenuated, it means that person can become infected. But at least there's no case like that. But people are just expressing their fears. So they rather use drugs or serums than use vaccines.
Your statement earlier about, Chairman asked some question about those that leave, the potential of those who have been discharged, yes, infecting others. Yes. There are those who believe that it will be generating fear, even amongst the people who are already in fear and trying to cut down on the panic level within the country. Are you implying that the authorities or the medical personnel who are the IDH now, or who came up to say that they're discharging these 4 patients, for instance, who've recovered and been discharged, are you implying that they do not understand exactly what they're doing for them to have discharged them?
No, they do. Now, right now, it's because it's not such a big epidemic, and that's why it's only IDH that is managing these patients. And like I clarified, I said if the volume of patients eventually increases, the volume might overwhelm the hospital. Now, what centers do is that patients that have the acute episodes are treated in a let's say, a level 4 center. By the time they go out of that acute episode, they are moved to a lower level center. They are moved like that till they can really clear this person of this condition. Now, IDH, they've had about 11 patients that they can handle. Now, in case other centers get involved and the volume of patients increase, we have to take into cognizance that the pressure might increase. Just an example, if you have a hospital that has 10 beds, you have 20 patients coming, you have to operate them. You might not wait for them to fully recuperate before you send them home, because you need to take those other 10 people, the 10 other people that are coming in, to treat them properly. So this has to be borne in mind. But I'm very certain that in IDH, you have virologists, people that deal with viruses, you have infectious disease experts, and then public health, and then coupled with the nurses and the allied health people that you have. So I would like to believe that they know that, but this is just to inform the public. And what I've just said is WHO documented. Survivors can transmit up to 8 months. You cannot keep someone in the hospital for 8 months. You cannot keep someone in the hospital for 8 months, but you need to monitor these people.
Okay, so we should, because we've been told that there are certain protocols that they usually observe, and that, you know, hope must be given to the public that Ebola is not a death sentence, that if you do come down with it, early detection is key.
Yes.
And from what we've also heard, is the first time that the Ebola virus is coming out in an urban area. In other African countries, what you find is that it happens in the rural areas, and before they can get help or even know what is happening, it's taken a host of the population and also spread uncontrollably. But how would you say that we are handling it? Would you say that we're on top of the situation and we're actually spreading awareness rather than panic?
Okay. It's a fact that I'm sorry to say, but Ebola is better controlled in rural areas and urban areas. Mm-hmm. Now, what has been documented and found out from studies is that because of the lack and improper transportation and movement in rural areas, when Ebola strikes a village, for instance, it might spread to that village, but most of the people within there, if they don't get help, might eventually die and does not leave that area. But because of the ease of movement in urban areas, you have to be very careful in tackling this. Now, what the government has done so far, and like you know, they've been giving kudos by different people, at least for our level of development, the government has really, really, really tried. More can be done. And then when we say more can be done, assuming the strike is called off and the hospitals open, then a problem might occur. If Sawyer did not go to first consultant and he went to a place like Louth, where he would have come in contact with like 10, 15 doctors, 10, 15 nurses, sent to a ward where you have like 30, 40 other patients, the epidemic would have been worse than this. Now, so, but because most likely in first consultant, it was in a private room and was quarantined. And to get private rooms in government hospitals, a lot of people will still go in and come out. Now, the government is doing its best. If the government is doing its best to contain this condition by enlisting help from without the country, outside the country, and getting people to volunteer. And from that's where the outcome of 4 people being discharged has come up. If they did not get any form of medical care, possibly those 4 would be seeing the obituary by now. So far, so good. But we are not to rest on our hands and to assume that things are going well now. We need to constantly improve the healthcare, the health delivery, and how these patients are managed.